Next up are warts, planner's warts. Everybody knows someone that's had one. A wart is actually a virus. It's pretty easy to contract actually, especially if you're living in the dorm room or if you're a kid, even an adult going to the gym. Kids that go to pools, public pools, parents that go to even their country club pool, be very careful. Always wear flip-flops right up to the pool's edge, and that's when you want to get into the pool. Warts, if you don't treat them, actually love to grow. They are viruses, so I always say that there's a mothership, and then they have little satellites. So you can get one large one, and they start branching off into other different parts of your feet, and then go to the next foot, and unfortunately, you can pass it on to your family. If you're not cleaning the shower really good, you'll be showering, and then you have your kid come in and take a shower afterwards, and then unfortunately, they get the wart. So at-home treatments, be very wary of what you can get over the counter. I've had patients come in that use an acid from various stores around, and they come in with a blister or an infection or something, and it's caused the wart to actually grow in size. So my recommendation, the first second you see a wart, please call us. We can do simple treatments that are not painful. You can use a mild chemical on it. Also, we can remove it with a laser, which is very effective because the kid or you can go about your normal day, wear your high heels, or go play soccer, whatever is needed for your daily activity. And it's the most comfortable way to actually treat it. You will have at-home treatment to use that you need to be diligent about doing. But overall, you can get rid of a wart. The smaller it is, the better the outcome. So make sure you don't go barefoot, don't spread it around, and be very careful about the areas you're in. In reality, you may be treating something called an IPK as a wart. Unfortunately, that's not the right thing to do. An IPK is something as simple as a clogged sweat gland, so a really hard nucleated callus that builds up into the sweat gland. It's not a virus, so whenever you treat something like that, you're only making matters worse.